Microphone's going on. 6 o'clock, we're starting the event
6.
right now.
Yep.
Hello, everybody. Welcome to Pittsburgh Medicare 101. This is our Medicare Made Simple educational workshop. I'm glad to have you all here joining us tonight. We've been doing these webinars since April when we couldn't actually go out and see people face to face anymore. We've been doing these educational workshops for a long time now in local libraries, and we're used to seeing everybody face to face. So if you could just type your name and hi down in the chat area there. I mean, we normally say hi to everybody in our live workshop. So I just want to know who's here so we can say hello to them and welcome you to the workshop this evening. So, hey, hi, Nancy. Nice to have you with us tonight. Thanks for joining us. Glad to see you here. Let's see, we have Frank and Tony. Thank you for joining us this evening. We're glad to have you. See, who else do we have? Lori, glad to see that you are here this evening. And so, okay, Cindy, thank you for joining us. So, I mean, we do have quite a few people signed up tonight. Some of you are, you are all here early. I've had a lot of people in the waiting room early. And for that reason, I don't want to wait and make you guys have been waiting patiently. So as the other people come in, they can just kind of join us. And we're going to jump right to the presentation now and get started. I want to make sure that everybody can see the screen that we have there. It's red, white, and blue, Pittsburgh Medicare 101. I want to make sure that you can see that. And just to go ahead and type yes, that you can see that. Okay, good. So just so everybody knows that they are on the right place, I want to go over the things that we're going to cover today. So we're going to be covering Medicare Parts A and B. We're going to be covering Medicare Part C, which are the Advantage plans. We're going to go over Medicare Part D, which is our prescription drugs, Medicare Supplements or Medigap plans, and probably most importantly, we're going to go over how to get help when you need it. Okay, so I'm sure that, you're just like this screen here, very confused. There's lots of confusing words. Everything's piled on. Medicare has not been made easy, and each year it seems like it gets a little bit harder. Confusing, the fact is all that mail you're getting, I mean, this is what somebody brought into us last week. There's about 30 pieces of mail here from all kinds of places. Some of it looks official, some not, but I mean, it's confusing. You know, you're probably getting a lot of phone calls that you don't answer and emails. I mean, we had somebody while we were still doing these live, she counted the number of phone calls she was getting from January through March. She had 250 phone calls about Medicare. I don't know if I'd count them all, but it's overwhelming. It's confusing, and you don't really know what to do. And that's exactly why we've decided to not only do the workshops in person, but the webinars now that you can't get to the workshop. Okay, so I have to get some important information out of the way. Actually not so much important as required, but I have to tell you this. Okay, so this event is only for educational purposes. We're not going to be going over any plan specific benefits, or we're not going to be going over any plan details. Myself, Bill Cardos, and my team here at Pittsburgh Medicare 101, we are not connected with or endorsed by the U.S. government or the federal Medicare program. But what we are is we are insurance and financial advisors. Myself and the other three people I have here in the office with me this evening have over 100 years of combined experience dealing with Medicare and retirement and Social Security. And we've seen all the changes that have been going on in the Medicare world. And what we like to say is we've seen the good, the bad, and the ugly, and the information that we've gathered in this workshop we have because we deal with all the carriers. We represent all the carriers in the area. We've seen what's going on with our clients, with the various carriers they've selected, and what we would like to think is we could steer you away from the bad and ugly and put you on the path towards the good. Okay. Who here, if has gotten this book, go ahead and in the chat area there, go ahead and type, yes, I've got the book or something. Let me know you have it. But what happens is Medicare sends this book out. Now, it was pretty standard. They used to send it out about 3 months before you turn 65. But since the beginning of this year, all bets are off. Some people get it 4 months before. We've had a husband get it 5 months before, a wife get it a month before. And we've even had people get it after they've turned 65. We had one gentleman get it 2 months after he turned 65. So obviously it's not very helpful to him in that situation because he already had to make his Medicare decision. But the good news is Medicare has all the information in here. It's very thorough and very good information about Medicare. The bad part of it is it was written by somebody with the federal government, so it's not the easiest to read. All the information's there, but you may get bored and fall asleep trying to find what you're looking for. Okay, but it's all there. Okay, and real quickly, we're going to go over what the Medicare card looks like. It's red, white, and blue. It has your name on it. It has your Medicare number, which is nothing like your Social Security number, which used to be on those old cards. And it only has the date that you started Medicare Part A, Medicare Part B. Now, they got rid of your Social Security number on it, your gender, your signature. Those were things that people could use right off the bat to steal your identity. So that's something good that they've done. The thing I do have to tell you about this is once you've signed up for Medicare and you know you're going to be getting it, keep an eye on your mailbox because this looks like nothing that you're getting in the mail already. It's a 5x7 envelope. It's white. It's nondescript. Don't throw it away. Who here feels like this guy standing in front of the Medicare maze? I mean, you know there's an end on the other, there's an end somewhere way off in the distance. And they feel like you're going to get lost. Well, we're here to help you through the maze today. And we like to joke that we have a map. And it's not so much a joke. We kind of do have a map through the maze. And we want to help you. Okay, so what we're going to cover today, we're going to go over the original parts of Medicare, Part A and B. We're going to go over Part C, the Advantage plans. We're going to go over Medicare Part D, which is the prescription drug coverage, and the supplements, the Medigap plans. So what exactly is Medicare? So Medicare is health insurance for three groups of people. Those people that are 65 and older, people under 65 that have certain disabilities, and people of any age that have end-stage renal disease. The program is administered and run by the Centers for Medicare and Medicaid Services under some pretty strict guidelines. I mean, they do have some a lot of regulations with this, and it's good because they've gotten rid of a lot of waste and fraud. You do have to be a U.S. citizen or lawfully present in the United States in order to get Medicare Part A and Part B. And right now, Medicare covers probably more than 60 million U.S. citizens. That's around 1 out of every 6 Americans. Okay, so sometimes people get these terms confused. They're not the same. They're not interchangeable. So let's clear that up. Medicare is for those three groups of people I just talked about on the last slide. It's an entitlement and health insurance program for people 65 and older, under 65 with certain disabilities, and people of all ages with end-stage renal disease. On the other hand, Medicaid, it's a joint federal and state program, and it picks up the cost for health care for those people with limited income and resources. Somebody that qualifies for both Medicare and Medicaid, they're called adult eligible. And again, both of these run by the Centers for Medicare and Medicaid Services. Okay, so first thing we're going to go over is the parts of original Medicare. So there's Medicare Part A, which is the hospital charges, and Medicare Part B, which is the medical services. It's all the providers that actually provide the care. And this is all there is to original Medicare. The important thing to know is if you only have Medicare Part A and Medicare Part B, it's not going to cover 100% of your expenses. Okay, and a little bit later on in the webinar this evening, we're going to go over some different types of policies that you can get that will help pick up the expenses that Medicare doesn't cover. So we're going to go over Medicare Part A first. And like I said earlier, it's our hospital insurance. And for most people, there's no premiums due. So in order to get Medicare Part A and not pay a premium, you have to have worked for 10 years or 40 quarters and paid your FICA taxes during that time. Now, if you didn't work 10 years or 40 quarters and your spouse did, you're going to get covered under their work history, and you don't have any worries there. But if you didn't work 10 years or 40 quarters, you can still get Part A. You just have to pay for it. Okay, and what you pay for it is based on how much you actually did work and the taxes you paid for FICA. So it's your hospital insurance, and this is what Part A covers. Okay, it covers your room, a semi-private room. It covers your general nursing care, your hospital services and supplies, your meals, and all but your first 3 pints of blood. If you need inpatient mental health coverage, it gives you 190 days of inpatient care per lifetime, and it offers care in 90-day blocks. Now, those 90-day blocks are if you're in the hospital 90 days in a row for the same illness or health condition. Okay, if your stay is longer than 90 days for that same condition, they give you some extra days. Okay, they give you 60 lifetime reserve days. So worst case scenario, something really bad happens, you could be in the hospital for up to 150 days in a row with the same illness, and Medicare is going to pick that up. Now, those lifetime reserve days, once you use them, they're gone. They're not there anymore. But those coverage blocks of 90 days, they renew essentially once per calendar quarter. The reality is that most people are not in the hospital for the same illness for 90 days in a row. So it's a very rare situation where anything like that would come into play. Now, Medicare does exclude some things. They don't pay for private duty nursing or your comfort or convenience items when you're in the hospital. Okay, a little bit earlier on, we said Medicare Part A and B doesn't pick up 100% of your expenses. These are some of the gaps in what Medicare will not pay for. Okay, so Medicare will not pay for days 1 through 60 in the hospital. They will pay for all the costs but the first $1,408. If your stay is longer than 60 continuous days, day 61 through day 90, Medicare will pay all but the first $352 of each day in the hospital. And if your stay extends 91 through 150 days, they pay all but the first $704 of each day. So the sicker you are, the longer you stay in the hospital. Once you pass that 60-day threshold, Medicare is going to be paying less. Now, that $1,408 charge, that could come up once per calendar quarter. So if you're very unlucky with when you get sick or have an accident, you could end up owing that up to 4 times per year. Again, some more gaps in Medicare Part A. They're not paying for the first 3 pints of blood. They're not paying for any cost beyond 150 days. Now, if you need some skilled nursing care, as long as you've had a hospital stay prior to that, okay, and go into a skilled nursing facility, Medicare is going to pay everything for day 0 through day 20. All those costs will be picked up. But day 21 through day 100, Medicare is going to pay all but the first $176 of each day. Now, if your stay in a long-term care facility is longer than 100 days, then you're going to have to take care of that yourself by spending your own assets, your retirement fund, or having some other kind of long-term care coverage. The other thing that's important to know there, this is only for skilled nursing care. It's not going to pick up the cost for assisted living or in-home care. And that's the short version of how Medicare Part A works. So Medicare Part B, medical insurance, this pays our providers. Now, the way this used to work in the past for almost everybody is your Medicare Part B premium was deducted from your Social Security check. Now, what is happening today is most people are not taking Social Security at 65 because that's not their full retirement age. When they do go on Social Security, the Medicare Part B premiums will come out of your Social Security check. But up until that time, from 65 until the date that you do go on Social Security, you will have to pay your premiums, and Medicare will arrange for you to do that either quarterly billing or bank draft or some other methods there. If you're one of those people that qualifies for the state Medicaid program, then the state will pay the premiums for your Medicare Part B. Enrolling in Medicare Part B is very important. This is where we see a lot of mistakes being made, a lot of trouble and issue. It's so important, we're actually going to go over it on 3 slides. Now, Medicare says Part B is optional. It's only optional for some people. And the reason we're going to go over this a couple times is there is a penalty if you do not take Part B at the correct time for you. That penalty is 10% for each full 12-month period that you should have had Medicare Part B but didn't. That's a lifetime penalty. It says on the screen here, the penalty is paid for as long as somebody has Part B. Well, guess what? That's lifetime. Now, Part B is optional if you are working and have valid employer coverage. You do not have to take Part B when you first turn 65. Now, the first opportunity to get Medicare Part B is your initial enrollment period. That starts 3 months before the month you turn 65. It lasts through the month you turn 65 and 3 months after. However, if you're working, you're not going to be able to exercise that. I mean, I should say if you're working with employer coverage. Now, if you have employer coverage and you're going to keep it, you're going to qualify for a special enrollment period for when you come off of your employer coverage. It does have to be from your current employment, your spouse's current employment, and that group medical plan has to be at least as good as Medicare. What you do need to do when you come off your employer coverage is get proof that you had continuous coverage past age 65, and that's what keeps you out of that penalty situation and paying that Part B penalty. Now, say you missed your initial enrollment period, you missed your special enrollment period, Medicare gives you one more chance each year to pick up your Medicare Part B coverage, and that's January 1st through March 31st. Now, here's the bad thing with that. Your coverage will not start until July 1st of that year that you signed up, so you're almost guaranteed that you're going to have at least a 10% penalty if you sign up in that general enrollment period. There is an annual deductible in 2020. That deductible is $198 for your Medicare Part B services. And then after that, Medicare pays 80% and you will pay 20% of the cost for all Medicare approved medical expenses. Okay, again, we're going to hit this another time. So say what we normally recommend if you're going to take Medicare right at 65, you want to start the enrollment process, get ready to sign up 3 months before, because as long as you sign up in month 3, 2, or 1 before you turn 65, your coverage will start the first day of the month that you turn 65. But if you wait till you're already 65 or the 3 months after, your coverage will be delayed, in some cases up to 6 months after you've turned 65. And you don't really want to go without the healthcare coverage if you need it, okay? Because that would be the time something would happen and you don't want to pay those expenses out of pocket. Now, we do run into people sometimes that have missed their enrollment in Part B. We had a gentleman in the fall that had missed it for 12 years, so he had a 120% penalty, and that was through no real fault of his own. He got some bad advice. I mean, that's why you need to make sure you're listening to the right people when you get your advice. We had somebody that was had been a federal employee, was on their pension plan and was told he didn't need to sign up. He did. He has a 50% penalty, so you want to make sure you sign up at the right time. Now, you can enroll in your premium-free Part A anytime after your initial enrollment period, but you can only get into Part B during the initial enrollment period and other times. And if you do a premium for Part A, that matches up. That's the only time you can get the premium Part A is the initial enrollment, special enrollment, or the general enrollment. And again, you will have a lifetime penalty if you don't get it at the right time. And one last slide, because it is important. There's no reason to have a penalty. We'll do everything we can in our power to keep you from having a penalty just because you shouldn't have it. It's easy to avoid as long as you follow the steps. So say your birthday falls in the month of April. Okay, the earliest you could sign up for your Part B is January 1. The latest is July 31. And during that initial enrollment period, special enrollment period, you can choose any type of plan that goes along with your Medicare. Okay, so they're all available to you. There's nothing that's excluded. Next, we're going to jump into our prescription drug plans, our Part D. And I will tell you, if there's one thing we have a ton of questions on, if we were to look at all of our questions, probably 80% of them would come because of prescription drug plans, because it's not confusing. They've made it a little bit better, Medicare and the plan providers, but it's still confusing. Once you go on Medicare, there's only going to be two ways that you can get your prescription drug coverage. Okay, if you're keeping original Medicare and getting something to go along with it, then you can get a standalone prescription drug plan. If you're replacing Medicare with a private insurance coverage, most of those will have the drug plan integrated right along with them, and those are called Medicare Advantage prescription drug plans. So this is easy. Who is eligible for Part D? Pretty much anybody that is entitled to Part A and or is enrolled in Part B. So that's pretty much everybody, okay? But here's the thing. You have to permanently reside in the area where the plan is offered. So in Western Pennsylvania, which most of our people attending the webinar tonight live, we have 30 plans available. You can only select your prescription drug coverage from one of those 30 plans. Sometimes we have people that will live outside of the area, and they will, maybe be 4 or 5 months in somewhere south where the weather's nice, and they'll see a prescription drug plan there that they want. Okay, and if that's not your permanent address, you can't get that plan. You have to get a plan where you permanently reside. People that qualify for both Medicare and Medicaid, they have the option to get these plans as well. Now, here's something that's important as well. And we see healthy people coming in that are 65 all the time, not taking a single medicine. And they say, why do I need to get a drug plan? Well, here's why. Because if you don't get Part D when you're supposed to, there's a premium penalty as well. And it's worse than that 10% penalty for missing your Part B enrollment, okay? So it's actually 1% per month until you sign up with a Part D plan. That's 12% per year, and that penalty is for life also. Okay, now there are people that do not need to get a Part D plan, and those people would be, say, if you have an employer plan that has credible drug benefits, if you have a retiree plan that has credible drug benefits, you don't have to get Part D. If you have VA drug benefits, that qualifies, and you don't have to get a prescription plan, and people that are on pharmacy assistant plans don't have to get their own Part D plan. Now, this is what causes all the confusion. Everybody that I sit down with, everybody that all the advisors sit down with, ask about the donut hole. That's probably the most discussed topic when we get into Medicare. So I'm going to try to make that a little bit easier to understand. Okay, so Medicare, each year they set out how the standard drug plan is supposed to work, and the drug plans have to be at least this good or better. So in Western Pennsylvania, 2020, all the plans are set up that they're supposed to have a $435 deductible that you pay 100%. The reality is in Western Pennsylvania, almost all the plans, if you're taking a tier 1 or tier 2 drug, they're going to waive that $435 deductible. You'll have a small or no copay for those tier 1 or tier 2 drugs. Once your drug cost has exceeded $435, you're in that yellow area on the graph. It's called the initial coverage phase. And during that initial coverage phase, you're paying 25% of the retail cost of your medications. Okay. Once the amount of your medications, the amount that has been paid by you and the insurance company goes past $4,020, you're now in the donut hole. Okay. Now, some of you may say, hey, wait, they told me that the donut hole is gone. Well, that is partly true. Now, there's still a donut hole, but what has changed in the past, the percentage that you had to pay while you're in the donut hole was more. It was 30% or 35% or even higher. Now, when you're in the donut hole, you're still only paying 25% of the cost of your drugs. So that's why they're saying the donut hole is gone. What has changed is who's paying the other 75% in the donut hole. Now, once the true cost of your drugs has gone past $6,350, you're out of the donut hole and you're in what's called the catastrophic coverage phase. That's over there in the far right in the brown. When you're in catastrophic coverage, your drug cost is only going to be 5% of retail or $8.95, whichever is the most. Now, as time has gone on, we've been doing this for quite a long time. We've seen people hit the donut hole more in the past than they have the last couple years. The last couple years, the people that we've seen hit the donut hole are people that have had, some severe cancer treatment, people that are on multiple diabetic medications. And the good news is we don't have information on the 2021 plans, but we do know that for 2021, the cost of the diabetic medications has been limited to a much smaller amount. And we'll just wait to see how that comes to play out. And that's pretty much how the Medicare Part D plans work. Okay. And if you, again, the thing I want to tell you, and I'm sorry I forgot to mention at the very beginning, is if you have questions, go ahead and write them down. We're going to have a dedicated question and answer session right at the very end. So if you have a question about Medicare Part A, B, or about the D or the donut hole, we will get to it and answer it. We found it's just better in this webinar format if we hold those questions till the very end. It just keeps the flow a lot better and keeps people following along a lot better. Okay. So, and this is what most people have come to the workshop for, is the choices when you're actually picking coverage. What should I do? I mean, what is going to be best for me? Okay. And this is normally where we see people make a mistake. Okay, yeah, we always have that little delay there. And this is where we see people running into errors. This is where they make their first mistake when they're picking Medicare coverage when they turn 65. The first mistake we see pretty commonly is you might have worked for a company for a long time and had the same insurance coverage from the same company for a long time, and it worked really well for you. You understand how it works. Your doctors participate, and the thing that seems to make the best sense in your mind is, hey, I'm going to go with that company when I pick a Medicare plan. They were good to me prior to the time I turned 65, so I'm just going to go with that company. Well, that could be a mistake, because the 65 and over plans are designed totally different than the plans that are the employer plans, because the employer plans, they're designed for families. They're designed to cover young children, single adults that are pretty healthy. And if you just blindly pick a plan based on who your coverage was through when you're employed, you could end up with some nasty surprises once you actually go to the doctor and use it come age 65. The other mistake we see people make is you may have a friend that's made this Medicare journey before you have. They've done all the research. They're a couple years past 65, and they've picked a plan that works great for them. And they just really tell you about how it's the best thing since sliced bread. And I don't know if we have anybody named Sally here tonight, but Sally seems to be the name we pick on. Your friend Sally says, this is great. I love my doctor. The plan works great. It doesn't seem like I ever have to pay anything when I use it. Well, here's the thing. There's quite a few people in the webinar tonight. Not one of you take the same exact medications as somebody else in the webinar. You probably don't even take the same medications as maybe your spouse or the person across the street. You definitely don't go to the same doctor, and you probably don't like the same health system. You may like to travel, and your friend Sally that told you how great her plan was, she may sit at home. She may never go any further than downtown Pittsburgh, and her doctor's a block away, and she goes 3 blocks away to the hospital. But you like to travel, and you have grandkids all over. You pick Sally's plan, you go to the doctor, and guess what? It's not paying anywhere near the way Sally's did, and you're not too happy. So the moral of the story is you have to figure out what's important to you and make sure you have a plan when you pick it that checks off all the boxes of everything that's important to you. Okay, so these are our choices here. It's kind of the fork in the road when we're picking our Medicare coverage. So the blue side is if you decide to keep traditional Medicare and get some supplemental coverage that fills in the gaps. It pays all of those things that we said Medicare didn't pay earlier on in the workshop. Now, if you're still working and you have employer coverage or retiree group coverage, that your plan may require you to get Medicare Part A and B. You do have to check with that. But normally those employer plans, they have a prescription drug coverage included, but you do have to check. The important thing there is to make sure that they're not requiring you to have Medicare Part A and B to keep that plan. Now, if you don't have that option available, you can take your traditional Medicare and fill in the gaps with a Medigap plan, okay? And they also require you to have Part A and B in order to get a Medigap plan, and you do have to get a prescription drug coverage to have complete coverage and avoid the Part D penalty. Now, if you take the other fork in the road, the right side, the red side where it says Medicare Advantage, what that is, it's a private insurance company. Okay, and they've entered into a contract with Medicare, and they agree that they're going to provide you care that's at least as good as the basic Medicare benefits, but they are taking over from Medicare for your coverage when you go that route. Those plans also require you to have Medicare Part A and Part B to have a Medicare Advantage plans. And in Western Pennsylvania, we have HMOs and PPOs. We really don't have much else available in the way of the Medicare Advantage plans. They will have your drugs for the most part included in those plans, but a few will not have drugs and may require you to purchase them separately. If you're one of those dual eligible people we talked about earlier that have both Medicare and Medicaid, they will have some really good HMO plans available for you folks, and it will include your prescription drug coverage. Okay, and all those options except for the employer group coverage will require you to have original Medicare Part A and B in order to have that. Okay. Okay, so we have our Medigap plans, okay? This is what takes over and pays for the things that Medicare does not, okay? And this is something I want you to write down in your notes and circle and underline, okay? And we're going to be talking about Plan G of the Medigap plans because that's by far the most popular in our area. So we have 62 carriers in Western Pennsylvania right now that have the same exact Plan G. Okay, these Plan Gs, and in fact, all the Medigap plans, they are offered under strict guidelines set up by Medicare. So if you're comparing Plan G, the benefits have to be identical. So if you look at Plan number 1, their benefit package is going to be the same benefits as offered with Plan number 62. Okay, so just keep that in the back of your mind. We're going to show you how that's important later on. There are 9 different Medigap plans, Plan A through Plan N. Plan A covers the least amount of things that Medicare doesn't pay for. Plan G pays the most. Those plans are standard in 47 states. 3 states don't follow the standard formula. We're not going to get into those because we don't have anybody viewing tonight from Minnesota, Wisconsin, or Massachusetts. Okay, and this is the grid that shows what's covered under those Medigap plans. And now this is probably included in most of the pieces of mail that you're getting. And each one of these boxes here is something we talked about earlier that Medicare doesn't pay for. So the more check marks you have in boxes, the better coverage the plan offers to you. Okay, so if we're looking down here, we're seeing Plan G with the most check marks, and so that's going to give you the most comprehensive coverage. The only block that's not checked is the Medicare Part B deductible, and this year that's $198. So if you select a Medigap Plan G, you know once you've paid $198 out of pocket, the plan and Medicare are going to pick up the rest of the expenses. Okay, and that's how Medigap works. So next we're going to jump into the Advantage plans. Again, just to remind you, this is where you're going with a private insurance company that's going to provide all of your Medicare services. If you're not in our immediate area, Western Pennsylvania, these numbers are not really going to apply to you. But for example, in Allegheny County, we have 7 carriers offering 41 plans. Butler and Westmoreland, where most of our viewers are from these 3 counties, we have 7 carriers and 42 plans. And I like to say we're kind of blessed and we're kind of cursed. We're blessed because we have great healthcare systems. We have a ton of options, but we almost have too many choices when we have those Medicare Advantage plans. It makes a decision very difficult. Most areas of the country have less than 30 plans to choose from, and in some cases, maybe only a dozen. Okay, so when can you get into a Medicare Advantage plan? Well, there's only valid election periods. Okay, so with the Medicare Advantage plans, you can get into them without any kind of health questions as long as you're in a valid election period. And the first one of those matches up with the first time you can get into Medicare Part B, the initial election period. The other time that you can do something with an Advantage plan, and that's change plans or get into it, is the annual election period. And you know when this is because it starts a couple weeks before Halloween, where every single commercial on TV from probably 5 in the morning till midnight or later is about some kind of Medicare health insurance plan. And that annual election period goes from October 15th to December 7th. Now, during that time, you can switch your Medicare Advantage plan. You can go back to original Medicare and get a Medigap plan. And if you have Medicare, you can go into an Advantage plan. And then there's one other period that Medicare added where you can get into an Advantage plan. And this is if you only already have an Advantage plan. And that's during the annual open enrollment period. And that's January 1 through March 31st. And what we kind of call this is the do-over. Okay, so say you went with the plan your friend Sally told you about. January 5th, you go to your doctor and you find out he doesn't participate in that new plan. You make a call to your hospital and find out they don't participate either. So this will let you find a plan that your hospital and doctor participate in. You can go back to your old plan or find a new plan. You have one chance to do it over and find a plan that works better for you. You can also decide you don't like Medicare Advantage and you can go back to original Medicare and get a Medigap plan. Well, that brings me to another point. So these Medicare Advantage plans, there are no health questions as long as you're signing up during a valid election period. The Medigap plans, on the other hand, they will not ask you health questions during your open enrollment period, which is 6 months before you turn 65 and 6 months after. You could be in the worst health ever, have a ton of serious health concerns, and they have to offer you the best plan at the best premium. But once you're outside of that open enrollment period with the Medigap plans, they can ask you health questions. And if they don't, if you're not answering the questions that they need to answer favorably, then they can deny you coverage. Now, we've found with 62 plans out there, there's probably a plan that will take almost everybody if you want to go that route. But again, you have to know the information for each of those individual carriers to know where to go to and not get a rejection. Now, there's one other time that you can change your Medicare Advantage plan or get into a Medicare Advantage plan, and that's if you move from your home area to a different area where there's different plans offered. So say you move from here to Florida, the plans that you have here are not going to work in Florida or South Carolina, so you will pick a plan that's offered in that area. The other situation is if you lose your coverage. Doesn't happen real commonly, but we have seen different times where a carrier will say, we're not offering this Medicare Advantage plan. They'll make that decision in March of a year, and they'll give you 63 days to pick a new plan, okay? So these are the only times you can switch the Medicare Advantage plans. Now, this is kind of where we put the two options side by side. And the important thing here is to figure out what's important to you and make sure you find options that come closest to meeting all of your needs. Like I say, make sure all of your boxes are checked off. So with the Medicare, original Medicare and the Medigap plans, all doctors and hospitals in the U.S. that take Medicare are going to take that option as well. So again, for the rest of tonight, we're going to be talking about Medigap Plan G. With the Advantage plans, they are going to have networks, okay? The HMO Medicare Advantage plans will require you to stay within a doctor and hospital network, okay? The PPO plans will let you go outside of a network, but normally for a higher cost. The Medicare and Medigap plans, they have no copays. Okay, the Advantage plans, they're shared expense plans, and they will have copays for most services. You go to the emergency room, there'll be a copay. There'll be a copay for outpatient surgery for your primary and specialist. So it's kind of a pay-as-you-go and need service option. Okay, Medicare and Medigap, there is the Part B deductible that you have to worry about, and you will have to pay that before Medicare or the Gap plan starts paying for anything. On the Medicare Advantage plan, there are no deductibles for the most part. Now, most of the plans that we've seen for 2020 have no deductible. Okay, so all $0 deductible plans, they're going to start paying for any healthcare needs you have right away. Medicare or Medigap, there's no out-of-pocket expense once the Part B deductible is paid. With the Advantage side, there will be out-of-pocket expenses. Those vary by whichever plan you choose and how the plan sharing or the cost sharing works in that plan and how often you go to the doctor. Okay, with the Medicare and Medigap, you do have to add prescription drug coverage. With the Advantage side, most often the prescription drugs is already included there. You don't have to worry about it. Now, why would somebody pick a Medicare plan with a Medigap? Well, the most popular reason people go that way is they like the freedom of choice. They don't want to have to worry about a network. They don't want to have to worry about paying more if they have to go outside the network. They can know that they can use any doctor or hospital in the United States. They like that there's no copays and there's no referrals. And the people that really like to run a strict budget and know what their healthcare costs, they have an easier time of doing this with the Medicare Supplement and a Medigap or a Medicare and a Medigap plan. Over on the Medicare Advantage side, the popular reason people go that route is normally it costs a lot less per month. There are low monthly premiums, and in fact, some plans that have a $0 premium. They're all shared expense plans, and people that go that route are okay sharing the cost when they actually have to go to the doctor or hospital. They may like the fact that the doctors and hospitals they're already using and familiar with are already part of that Medicare Advantage plan. They like the fact that prescription drugs are included with that already. And for them, the plan choices are simpler. It's an easier plan to use. I'm not saying the Medigap Medicare Supplement is better. I'm not saying the Medicare Advantage route is better. Everybody has different needs. And again, what's most important to you is make sure all of your boxes are checked off of the things that you think are the most important when you're making this selection. Okay, I'm going to talk a little bit about using an unbiased advisor as compared to going directly to an insurance company or using an agent that only works for one company or a couple companies, okay? And I say unbiased advisor because that's the model we're set up to use. We offer all Medigap plans, all Medicare Advantage plans, all prescription drug plans that are available in our area. So we're going to give an unbiased opinion of those plans and try to find what works best for you. However, if you call an insurance company, you're only going to find about the plans they offer. Or if you go to an agent that only works for an insurance company or a couple insurance companies, there's going to be limited plan details available. Okay, the unbiased advisor should be finding out what's important to you and discover what your personal needs are. Sometimes you don't know what's important until somebody starts asking you questions and say, yeah, something I never thought of. That is important to me to have that benefit. Okay, the insurance company, you go that route, they may not help you figure out what's important. They're going to tell you what they have and see how close they can come, and there probably is going to be compromises. Okay, you're not going to have full details. Okay, on the unbiased advisor is you're going to have personalized plan coverage, so you'll be able to select the best options from all the carriers that are available in that particular area. Again, going to a single insurance company, making a call, or going to their website, there's going to be the plans are going to be shown to you that are available through that carrier. And again, it's just a limited choice of plans. Unbiased advisor, you'll have options and choices. You can compare plans from different carriers side by side. You can do a what if. You can say, what happens if I stop taking this medication? What happens if I decide to move to South Carolina to live? Okay, and you can, all those different scenarios can be run. Whereas an insurance company that only offers coverage in this area, they aren't going to be able to tell you that. And here's the other thing is they're not going to share with you if there's a competitor out there that has better plan options that really suit your needs. Okay, I kind of compare it. You say you're going out looking for a brand new truck, and you walk onto a car dealer's lot, and it's a Ford dealer, and that salesman comes out, he's going to tell you every great option that a Ford F-150 pickup has and try to convince you that you need what's in that truck. Whereas there may be a GMC down the street or a Dodge Ram that's better suited, that has exactly what you want. And I can pretty much guarantee you the Ford guy is not going to offer that information to you. Okay, he wants to sell you a Ford. Okay, the Unbiased Advisor, annual personalized follow-up with you, because the one thing we do know is our health condition can change over time. I know personally I don't take the same medications now as I did 15 or 20 years ago. I know that I go to the doctor more often, and that's probably going to happen as time goes on as well. So you want to make sure that each year those things are taken into consideration, and that you continue to have the best plan. Because the other thing that can happen is maybe nothing changes with you. You're still just as healthy. You're taking the same medications, but that plan may change how it works internally. And what's a great plan for you this year, you may have out-of-pocket expense coming out the ears next year. And so you need to make sure that you have that annual follow-up. Now, you go directly to an insurance company or an agent, guess what? You're going to get an annual plan update for how your current plan is changing, or if it's even going to be offered for next year. Okay, the other thing I like to compare, excuse me here while I get a sip of water, is dealing with an advisor that's in your immediate area as compared to maybe somebody that's calling you because you filled out a postcard and they're calling from Arizona or Florida or somewhere far away, okay? So again, I'm comparing us as the local advisor. So we know the Western Pennsylvania market, and I know most of the people here are in the Western Pennsylvania area. So we have years of experience. We have a ton of clients that have picked all different kinds of plans, and we know their experience with the carriers. We know, if they've had roadblocks, maybe getting a predetermination, having the number of visits they want, difficulty with medication, and we can use that information to maybe steer you to a plan that would work better for you. That advisor from out of state that's giving you a call, guess what? They sell plans all over the country. There's over 5,700 Medicare Advantage plans across the United States, and they're not going to know the best options in any one area of the country well, okay? And they're not going to know, the guy in Florida is not going to know what we like here in Western Pennsylvania and what works best for our clients here. Have access to all local plans information, and can offer coverage through any company regardless of what you want. Okay, we can, whether it's company A or company number 62, we can offer that coverage. So the distant advisor is probably not going to have access to every single company that offers insurance coverage in Western Pennsylvania, and they're going to tell you again what they have available that's being offered in Western Pennsylvania. We can show you as much detail or as little detail as you want, okay? We can show you the top 2 plans. We can show you all 62. Nobody really wants to see that, but I mean, we can show you everything. And again, there's no incentive for us to push you one way or another, because we sell every plan. We just want you to get the right one for you, so you're happy with the service. Now, that distant advisor, there's going to be a limited choice of plans, and sometimes in those situations could be incentive for them not to mention certain carriers' plans, so you may not be presented with all the options that are available to you in this area. Here's something that's important. You can find us. Okay, we're right here in the North Hills. You can come to our local office when all this craziness is over. You can sit down with us and have a cup of coffee or water and get details of your plans. You can have your problems answered. We also have agents all through the area. We have office in the northern part of northwestern Pennsylvania as well. So we're pretty much local to most of the people that are on this webinar. And nationwide, we're also part of a nationwide company that has over 40 offices, okay, and close to 1,000 advisors. So pretty much wherever you happen to be, you're going to find somebody that knows us and can get you the help you need. That distant advisor, here's the question: where the heck are they? Okay, they could be thousands of miles away, and the agent you're talking to this year may not be there come January 1st, okay? And the person that calls you from there, or you call to get an answer for, may have no idea what you're talking about, okay? You're going to get an annual personalized follow-up, which is very, very important to make sure you're having the lowest healthcare costs, the most comprehensive coverage that checks off all of your boxes. And that distant advisor, probably not going to be any follow-up at all, okay? So here's the other thing that most people want to know. Well, what's it going to cost me when I go on Medicare, okay? So both options, whether you have traditional Medicare and an Advantage plan, they're going to require you to have your Medicare Part A, okay? And it costs $0 for those people that have worked the 10 years or 40 quarters. They both require you to have Medicare Part B, and the vast majority of people are going to pay the standard Medicare Part B premium, which this year is $144.60. Now, there are extra charges if you make higher income, okay? And if you're in, you think you might be subject to that, just shoot us an email, or get in touch with us afterwards, and we can go over what those premiums are at the different income levels, okay? But it doesn't matter, because you have to have the Medicare Part B to have the Medicare Supplement or the Advantage plans. Okay, the Medigap plans, okay? What do they cost? And this is always the part where I get dry from talking, so get that cough out of the way. So remember what I told you earlier is, and write down, circle, all Medicare Medigap Plan Gs have to offer the same benefits. Well, in our area here in Western Pennsylvania, we have Medigap Plan Gs ranging from $99 the whole way up to $315 a month. And the question I get asked all the time is, why would somebody pay $315 for the same benefit that they can get for maybe $99 or $110? Well, the reason they're paying $315 is maybe they're being a stickler about wanting to go with a name that they think they know, or maybe that's the only plan they were shown. Okay, so again, the Medigap plans are all the same. There's a big range of monthly premiums, and you wouldn't know that unless somebody has all the plans available. Now, over on the Medicare Advantage side, what's that going to cost? Those plans there are low or no monthly premiums with those plans. And some of the plans are $0 a month, and they have a great benefit package. But they also plans that go more than $300 on the Medicare Advantage side. And with the Medicare Advantage, this is not one of those situations where paying more money gets you better benefits. There's a lot of times we see plans that are $50, $60 a month range that have benefits that are far better than that $315 per month plan. Okay? So if you're going with Medicare and a Medigap, you're going to have your Part B deductible of $198. It's not there on the Medicare Advantage side. You will have your Medicare Part D premium that you do have to pay, and that's not there on the Advantage side as well. Okay, so you have a monthly bottom line. If you're one of these budget-minded people, you go with Medicare and Medigap. You're going to have your Part B that you have to pay to Medicare. You have your Medigap plan premium that you have to pay. And if you go to the doctor, you have your Part B deductible and your Medicare Part D. And you can pretty much figure out what your monthly health expenses are going to be. Over on the Medicare Advantage side, you will have your Medicare Part B premium, whatever your Medicare Advantage premium is. And then as you go to the doctor, as you need hospital copays and prescription copays, you will have to add those in. So if you're pretty healthy, it's kind of easy to figure out what your expenses are going to be. If you're not, if you use the doctor a lot, that's where it gets a little bit tricky. Again, not one side is better than the other. The going with Medicare and Medigap is not better than Medicare Advantage. Some people just like to know the budget and they like to go that route. They want the more comprehensive coverage. The people that get the Medicare Advantage really are not counting on getting sick, and they think that they're going to be further ahead, and they kind of have it there for the big issues that come up, and it works well for them. Okay. So we talked earlier that you have to enroll in Medicare at the right time. Okay, and there are three situations of when it's time to enroll in Medicare. Three things that we commonly see, and one is if you're still working and you're covered under your employer group plan. That's one situation. The other situation is if you're collecting Social Security already, and the third is what we see more and more commonly is if you're not collecting Social Security already. Okay, so say you're still working and you're covered under your employer group plan. When should you enroll in Medicare? Okay, well, the first thing you could think about doing is staying with your employer group insurance. Okay, and in the past, say maybe 5 years ago, 4 years ago, almost all the time, this would be the option that we would recommend, because the employer group coverage was almost always less than the Medicare, and getting an Advantage plan or a Medigap plan. Okay, and if that's the case, then you can delay enrollment in Medicare. You'll have no penalties and no loss of options. What we've really seen to start to happen about 18 months ago is the employers are sharing costs more of the employees with the health insurance. It means more is coming out of your paycheck, whether you're every other week or every month or however you get paid. More is being taken out to pay for that health insurance coverage. The other thing we've seen happen is deductibles have gotten pretty high. We've seen some high deductible plans with, say, a $5,000 deductible that has to be met before the plan pays anything. And we've seen out-of-pocket maxes get very high, $7,500, $10,000, $13,000. Okay, so if you're in a high deductible plan and you're paying a lot each month, it's could probably be in your best interest to go with Medicare as soon as you're eligible, and to get a some other kind of supplemental plan to go along with that, whether it's Medigap or Medicare Advantage. The thing you do have to look out for is if you have a spouse that needs that coverage, or maybe a dependent child still that needs that kind of coverage from the employer, that may sway your decision. But we have even seen, just starting this past January, situations where it was quite a bit less money for the employee to take Medicare and get some other coverage along with it, and put the spouse on a private health insurance plan, and they were saving themselves a couple $100 a month or more and ending up with better coverage than what was offered through the employer. So you have to look at this closely. You have to set the employer plan down right side by side with that the Medicare options available to you. And sometimes that's tough. We do that all the time. And if that's something you need us to do, just let us know. We're happy to do that. Now, if you're not going to stay with the employer plan, you can leave it, okay? Enroll in Medicare, and then you can select either a Medigap or Medicare Advantage plan. Now, so you're already collecting Social Security. This is probably the easiest situation out there of any of these three, okay? Because what happens is Medicare is going to enroll you automatically in Part A and Part B if you're already collecting Social Security when you turn 65, okay? If you have some other kind of insurance coverage, say you have employer coverage and it's credible, you can delay your enrollment in Part B and not pay that premium. You just have to check on the back of your Medicare card and send it back. But if you don't have that employer or retiree option available, then you get your Medigap or your Medicare Advantage coverage to pick up what Medicare does not. And finally, this is what we're seeing more and more often, because most people are waiting to full retirement age to start Social Security or later, so they're not picking up Medicare or Social Security right at 65. So you have to do something on your own, okay? And what we have found is the easiest way, especially since the pandemic has come along here and government services have been limited. We found the easiest way is to go directly to the Social Security website. And that's at ssa.gov to enroll in Medicare. Now, once you get to that SSA website, the block says Enroll in Medicare is right near the top on the right-hand side. Just click it, follow the instructions. And we do recommend starting that process 90 days before your birth month. They've even made it so you can start it a little bit before 90 days. Okay. And why we say 90 days is sometimes people run into problems getting into their Medicare account, getting into their Social Security account. And this gives you plenty of time to fix all those issues, so you have your Medicare coverage start exactly when you need it to. Okay. Now, what we suggest you do is if you're doing it on your own, is there's going to be a screen they tell you to print with your reentry number. You want to do that. Okay, to verify that you have enrolled exactly when you're supposed to. Okay, because what has happened is we've had people that have done everything they're supposed to, and then they go to use their Medicare services and they don't have it. They go to sign up for Medicare and find out they're facing a penalty. This would happen a lot more often, like if they went directly to a Social Security office in person in the past. But if you have this reentry number and you keep it in a safe place, it's pretty easy to say and produce it. Say, hey, look, I did everything I was supposed to when I was supposed to do it. The problem's on your end. Okay, and as long as we've had proof that somebody has done what they're supposed to at the right time, it's easy to fix those problems. It's almost impossible to fix, like that gentleman that we talked about that was 12 years past, 5 years past. If you did what you're supposed to and mistake was made, it's hard to fix if you don't have proof. Now, if you don't feel that you're technologically comfortable to do this on your own, we can do this here for you in our office. Some weeks we do 10 or more of these. We help people with it. I mean, your other option used to be to go to make an appointment in a Social Security office and walk in and do it, but they're not open right now. Okay. And their services are limited, and you could have a difficult time with that. And like I said, if you feel more comfortable doing face-to-face, watching somebody do it, then like I said, we're more than glad to help you with that. Okay, so once you've gotten your Medicare this route, if you have retiree or group insurance, you can select that option if it's the best choice, or get your Medigap or Medicare Advantage plan. These are some helpful websites for you. The first one is medicare.gov. The second one is mysocialsecurity.gov, and that's a really useful site. It has a lot of good information about your specific Social Security benefits, and that's helpful to most people. And the final one is mymedicare.gov. And again, this is Medicare details about you specifically. Say once you have Medicare set up, you've forgotten who your doctors are, you can click a link in that mymedicare.gov site and see when your doctor's visits were, who the doctor that treated you. You can find out your medications. And it's one of the most useful things that we've seen Medicare do. And it really is. It's a useful thing. Okay, so who here remembers this guy from back at the beginning? Okay, we know Medicare is confusing, and we hope the webinar tonight gave you some more details and made it a little bit easier for you. There's that endpoint over there, and we know you still have a lot of decisions facing you, and you may not be entirely confident then you're going to get over to the end of the maze the easiest way possible without bumping into some blank walls and hitting some dead ends and having to backtrack. But there is an end to the maze. And here's the thing, okay? I mentioned earlier that we have a map to the maze. I kind of say it jokingly, but we really do. And we like to say in this slide that this couple came through the maze. They're smiling and happy because they worked with us and followed that map that we provided. And something I'm going to get into a little bit more in a screen later on is that we offer everybody that comes to one of our live workshops in the local libraries, community centers, everybody that attends one of these webinars, a service called Medicare Done For You. And that's a free service. And I'm going to get into that a little bit more later on. But here's the thing, there's a lot of Medicare decisions coming up. It's not as easy to get information now as it was beginning of the year for obvious reasons. Okay, so I know some of you could be 6 months or more before you actually need Medicare. And that's not too soon to start planning and start getting an idea of what your options are. So it's okay to start charting your course through this maze early. Okay, I mean, because here's the good thing is, like, once you figure out what you're going to do, what your path is going to be, whether you're doing it 6 months before or 3 months before, it's going to give you some peace of mind. Okay, it's going to give you a better feeling because you can know that you're going to be able to throw away all that stuff that you get in the mail, and you're going to be more calm, because you have certainty. Okay. Now, why should you work with us here at Pittsburgh Medicare 101? Okay. I mentioned earlier that we're part of a bigger group. We have over 40 offices nationwide, close to 1,000 advisors, and our home office developed this great technology for us. We have exclusive technology, proprietary software, where this is the only place I know we can find out what's important to you. We can find out who your doctors are, what medications you have to take, where you like to travel, and what drugstore you want to use, and put it in our computer. And our software is going to let us do side-by-side comparison with all the plans, all 62 Medigap plans, all 41 or 42 Medicare Advantage plans. Okay, it's going to tell us whether your doctors participate in all of their offices, some of their offices, or maybe only a few of your doctors participate. And importantly, it's going to tell us what your prescriptions are expected to cost for the rest of the year. And that's pretty precise, and that's important because sometimes you can pick a plan that your doctors participate in, but you have terrible coverage with your particular prescriptions that you need personally. And you could end up paying anywhere from $2,000 to $3,000 more, if not more, out of pocket if you pick the wrong plan. And this is a software, as far as I know, we're the only people that have it. Okay, we have people that come in that work for other companies that are looking to work for us, and they see this and they're like amazed because they have to do it by hand. And truthfully, a couple of years ago, we did too. So this is great software for us. Okay. The other thing that we have is we're able to go and see how each insurance carrier, their health in Pennsylvania, how many people they have covered under their plan, because an important thing for how you get coverage and how your premiums increase over time is how many people have that particular coverage in Pennsylvania, okay, or whatever your particular state is. So I can tell you, we're looking at two plans. The premiums are very close to the same here. One's $138 a month. The other one's $137. But this plan, it's $138. There's only 5 people in Pennsylvania that have that coverage. Okay, this other plan, there's 720 people that have it. I'd rather see you go with a plan that has more than 10,000 people have the coverage. And some of the plans, there's more than 100,000. So if there's 100,000 people that have this insurance coverage, you're going to be pretty confident that you're not going to have big premium increases often. Okay, so we're able to look at all this. Again, this is something that only we have. Okay, and then we do things different. Okay, we're going to show you the details, okay, as much as you want or as little as you want out of all the choices that we're going to show you. Like I said, we normally will bring up the top 10 plans because most people don't want to see plan, 11 through 41, okay? We represent all the companies, so we're going to give you unbiased options and choices and advice about all those plans. Okay, the Medicare Done For You service, it costs $0. Okay, and we just found this out. We have an advisor here that is going through the same process that you all are. He turned 65 recently, so he is watching what everything he could find. Even though he knew it, he wanted to see what else was out there. And there are some people that run these webinars that will charge you $500 for the Medicare Done For You. And that's not $500 per household. Say if you have a husband and wife both going, that's $500 per. and they charge $150 each year for those annual reviews. And those are all things we do at no cost. Well, the question we always get asked, whether we're here in a webinar, whether we're live face-to-face in a library, is how can you do that service for zero? So here's the thing. We represent all the carriers. We don't care who you pick, who you go with, but when we assist you with that enrollment and submit that enrollment, when you pick that carrier that's right for you, then that insurance carrier pays us for our services. They're actually paying for the Medicare done for you, because we're making sure that you're educated, and we're going to be probably their first line of client service for you. So we're making it an easier time for them to have you as a client, and that's why they're happy to make sure that we can provide you a Medicare done for you at $0. Okay, and again, like I said, we don't really care who you pick, where you go to. The carrier's paying us for those services. Here's the other thing I mentioned earlier: calling an insurance company directly, going to their website, or having independent advisors like us do it. It's not going to cost you any more per month, regardless of which way you go. If you pick a Plan G and it's $99 through the carrier, guess what? It's going to be $99 through us. If you pick an Advantage plan at $0 and you go right to and call an insurance carrier or go to their kiosk in the mall, it's going to be $0 if you use us too. Okay, so it's not going to cost you any more to use these services. Okay, so we're going to jump in to the question and answer session. We will have a way for you to contact us. I'm going to put a way on the screen for you to schedule a Medicare done for you right now tonight. But when we're all done with the webinar as well, then you will be taken to one of our contact screens where you'll be able to do that. So we should be done with that screen sharing now. And let me know if we're back to the, okay, so let me do one thing here. We want to get that way for you to schedule up there. And then I will be taking questions. Okay, so right at the top of your screen is the Medicare done for you, the schedule now. And the thing that I do want to mention, okay, so what we would normally be able to do if we see you in person would be give you something to work with. So we do have this guide that's from our company, the Navigating Medicare. So everything that's in that big 128-page book that you get from Medicare, we have here in 20 pages. Anyone that signs up for Medicare done for you, we will make sure you get this Navigating Medicare book, and it's kind of a workbook to go through and figure out how things work. So we're starting to get questions here. Okay, so if I'm still working, and this is from Fred. Okay, I'm still working. Is there a penalty if I don't sign up for Part B? Okay, so here's the thing. As long as you have credible coverage, Fred, okay, that's at least as good as Medicare, then you will not have a penalty. Now, the one thing you do have to watch out for is if you have a small employer, less than 20 employees, there's special rules. Get in touch with us. We will go over that with you to make sure that you're not going to face a penalty. But then when you're ready to leave your employer coverage, there's two pieces of paperwork that you need to get filled out. You get those over to Social Security, and there will be no penalty whatsoever. Okay, so did that answer your question for you, Fred? Okay, so I have a comment here from Nancy. Okay, so thanks, Nancy, for the comment. So thank you. It's been very helpful. If I select a Medigap plan and my situation changes, the cost of the plan increases, is there a penalty to change companies? Nancy, that's an excellent question. There is no penalty to change Medigap plans at any time. And you can change those from month to month, okay? There's no special period of time when you have to change Medigap plans. The thing that you do have to do, though, is qualify based on your health. The Medicare plans will ask you health questions if you're outside that initial enrollment period. Okay, if you had some health issues go on, it might be a challenge. But again, what we found over time with 62 companies out there available, there may be one company that doesn't like you if you're taking two same diabetic medications and a blood pressure medicine, and 15 other companies will say that's fine. It's just know the rules, play by the rules, and be able to get the coverage. Now, did that, hopefully that answered your question. Okay. So, Cindy, I'm between jobs and turn 65 in September. If I sign up for Medicare, can I still take my employer insurance when it's available? Yeah, that's certainly an option. It's adds a couple more steps. I'm not going to tell you it's totally uncomplicated. It's supposed to be easy, but there are procedures that you can go through with Social Security to stop your Medicare Part B once you pick up employer coverage, as long as it's credible, and then reactivate it when you leave your employer coverage. It is a little bit more complicated now because those kind of things are normally supposed to take place face-to-face inside a Social Security office, and we just don't have that now. They do have some procedures, and if you get somebody that's knowledgeable, it's slick, it works just like it's supposed to. And when I say knowledgeable, I'm talking about at Social Security. But sometimes, like I said, it's some work, okay? And if you have more questions about that, we're glad to guide and help. But you do not want to miss that Part B enrollment, especially if you're not, so maybe you get employer coverage or you get employed in November, 90-day waiting period for your employer coverage to start. Guess what? You're a Part B penalty already, and you don't want that. Okay, Claudia, do we have location in the South Hills? That's a very good question. Our office is in the North Hills. We have advisors in the South Hills, and if what they are able to do is they can come to you. Okay, I mean, if we get to a point where libraries are open, we can meet in a library, we can meet in a Starbucks or Panera or a restaurant, or we can come directly to your house and do this personally, face to face. So we want to make your transition to Medicare as easy as possible. We do have more resources right here in the office. We can put things on a big screen and do that what if in real time, but we definitely are used to doing this in people's homes as well. Okay. So what other questions do I have there? Fred. Okay, so another question. Good question, Fred. So with a Medigap plan, I can go to any doctor I want. Yeah, so as long as your doctor participates in Original Medicare, you can go to any doctor. You don't need any referrals. Say you have something strange going on, you have an unusual cancer, God forbid, and somebody here in Pittsburgh says you have to go to MD Anderson and a specialist in Texas. As long as that guy takes Medicare, you can go see him and know that it's going to be covered with your Medigap plan. So what other questions do we have here? Okay. Okay, so I do see a couple people typing questions while those are being typed. I do want to remind people we do have the Navigating Medicare booklet available for the people that sign up. Okay, so we have a question from Patricia. Thank you, Patricia. So it says you just started receiving Social Security's widow's benefit. Still working, but your job is not secure. Okay, so what do you do if you're laid off or offered a buyout? Can you get Part B, Gap, or Medicare Advantage immediately, or do you have to wait? Okay, if you have a Medicare card in the mail right now, your birthday's in October, your Medicare can start October 1st, okay? If you have employer coverage right now and you think you're going to be having that in October, then you will be able to delay that Part B. If they give you a notice of termination, normally what will happen is, say you're at the beginning of the month, your benefits through your employer will last through the end of the month. And that should give us enough time to get your Part B activated, to get the forms that you need from your HR at your old employer to get your Part B started. And then, get whatever option you want, your Gap or Advantage, the first day of the next month. So say all these bad things happen November, your employer coverage will run through the end of the month of November. As long as you don't wait till November 29th, we can have you set up with coverage to start December 1st with no gap or no lapse. Okay, I hope that helped, Pat. That was good. Okay, so other questions. And Fred, we can help you sign up for Part B. Absolutely, we're happy to do that. We do that all the time. We can help you with that Part B sign up, whether you're in initial enrollment coming up on 65, or if you're leaving your employer coverage and you're past 65. We can take you by the hand and get you through the easiest and best way to do that. Make sure that all the forms are filled out that Social Security requires, because we want to make sure, most importantly of all, that you do not have a penalty. Because we hate penalties. We hate seeing somebody pay more than they should have if they were able to do the right thing at the right time. Okay, so we have had some good questions there. Now, do we have any more questions? Okay, we're about 20 after 7 now. We want to leave it open for a couple more minutes with questions. Again, the people that were here, I do want to thank you for coming this evening, for being part of the Pittsburgh Medicare 101 webinar. We will, as soon as we can, we're going to be back out doing these in libraries all over the area. We've been everywhere here in the north, the whole way up to Erie, and we've been south, not quite as far as Washington, but down into the very top part of Washington County, and we're happy to see you at those. If you have questions, we're happy to see you here in the office. We do virtual, and something we've gotten really good at is being tech support as well. If you're having issues connecting with the virtual, if we're doing a virtual Medicare done for you, we're more than happy to do our best to walk you through those things as well. Okay, Lori, thank you. I do want to say you did meet with us the other night, and we were kind of scatterbrained, didn't give you the book. Sorry about that, but we will be more than glad to make sure that you get that book, Lori, and you have it available to you. And we'll discuss once the webinar is over, whether you want a mail copy or an email copy. We'll get you whatever is easiest for you. So what other questions do we have? Okay, we have a couple people typing all at the same time, so we'll wait for one of those to pop up. I love questions. We like to get to answer questions, so that's great. Again, we have the box up at the top. If you think you want to get together with us, you can schedule your Medicare done for you now. I see that we've gone longer than 10 minutes. Our box went away. We're going to put that back up there, let it run for some more. Okay, so I would like to schedule, this is Claudia, okay, I'd like to schedule an appointment, but it won't be 65 till January, okay? Would it be appropriate to schedule something? So Claudia, here's what I would suggest, okay? So we're just getting some ideas of what the 2021 plan details are now for all the companies, okay? We're not allowed to have that information till October 1st. But once we have that, we can share that with you, okay? And so I would recommend, if you want to schedule now for earlier October, we'd be glad to put you in the schedule and get that time reserved for you. I do have to tell you that for us, okay, October through December 7th is busy time of year for us. It's like Christmas in retail, because this is when everybody can change Medicare plans. It's times when we meet with all of our clients we have already. It's times when we go to a couple different Walmarts and help people sign up as well. So if you do want to get in October, we would have all the plan details then, and we could sign you up in October for a January 1st start date. So yeah, Claudia, I'd be glad to hear from you and get you that time reserved in our schedule. Frank, make sure that we have your email address. We'll get you a copy of the book out. We like to help people out. We like to, sometimes the book makes more sense if you're here doing the Medicare done for you. It's kind of a workbook, but it's okay to have it and not be here as well. Okay. So any other questions that we have? Okay, so if we don't have any more questions, I'd like to thank you all for coming. If you have no more questions, you can enjoy the rest of your evening. I don't know whether it's raining outside yet. It's supposed to, but if it's nice, you can get out and enjoy that. I will stay here for another minute to have more questions, but you know what happens, a lot of people, they forget something. They want to ask a question 10 minutes from now. The thing they want to ask pops in their mind. It's okay to shoot us an email. We're glad to answer those questions, or give us a call. Like I said, we have a lot of knowledgeable people here. We're glad to share that information with you and get that out to you. So again, if there's no more questions, again, thank you everybody for coming. If you enjoyed the webinar, we're going to have a replay of that available for you within a couple days. Once this has been produced, we'll get that link out to you. You'll be able to go back over this and review it. If you have any friends that are turning 65, be sure to tell them about it. They can get us through our Facebook page, and we're going to, keep marketing this and having this out there on Facebook, the availability. And then when we get back out to able to go to libraries and community centers, we'll have that information out there as well. So we have, looks like we have another person typing a question. We'll wait for that. We won't. We want to give everybody the opportunity to ask and get the information they need. Okay, so where are we in the North Hills? Okay, so, and that's from Pat. So Pat, we are right up off of McKnight Road. I tell people we're real near Passavant Hospital, North Park Lounge. We're in the McCandless Corporate Center by where the Fridays used to be. And we get you directions very easily. Like I said, that is our only location in Pittsburgh. We do have a location in the far northern part of Pennsylvania, and we do have a couple advisors that are in the South Hills that can come to anybody in that area. We have advisors in the east also. If you're say Monroeville, Greensburg, they're able to service those people as well. Well, again, thank you, everybody. If no more questions, we are going to conclude our webinar tonight. You've been a great audience. I've really enjoyed the questions. I want to thank you all so much for that, and hope your Medicare path and decisions are easy ones. Take care.